Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. So let's continue with our neuro system, and in this video we're going to talk about our sensory assessment. And with our sensory assessment, we are talking about our ocular, our eyes, and also our auditory, which is our ears. So with ocular assessment, so what are we assessing with our ocular assessment? Actually, we assess our visual acuity, which with the use of a ceiling test, and during this check, we normally have the patient wear the corrective lenses for distance vision, and it should always be worn during this test. So some of the things that you'll be checking for, you'll be checking for nearsightedness, which is myopia, and this is when distant objects appear blurred. Farsightedness involves close objects appearing blurred, and farsightedness associated with aging. This is where a progressive condition with the lens. It's a progressive condition with the lens of the eye where it loses its ability to focus. This is actually age-associated farsightedness. We also will be checking about muscle degeneration, and this is a progressive disorder of the retina causing the loss of central vision, as well as if the patient is legally blind. It's also when the vision is better in the better eye does not exceed the 20/200, or whose widest visual field diameter is 20 degrees or less. Also, with the ocular assessment will involve the external eye exam, how the eye looks outside. There will also be use direct or indirect ophthalmoscopy, the scopy of the in and outside of the eye, and the tonimetry, which is the measuring of the interocular pressure. So for treatment of visual acuity problems, we have which would be abnormal refractory finding. Treatment is correction lenses, and patient also could have some laser eye surgery, which is also known as LASIK. The procedure changes the shape of the cornea with a goal of restoring the 20/20 vision. So some of the common optical problems involve or are: one, the detached retina. So what is a detached retina? A detached retina occurs when the sensory retina separates from the pigmented epithelium of the retina and can be related to either age or trauma. Some signs and symptoms of this involve or include some sudden visual disturbance, flashes of light that a patient will report. They'll also have some blurred vision with floaters. They'll see like they have a floater in their eye, and they'll also say they see like curtains or shadows over their visual field across the eye. This will be corrected with an operation, and preoperative nursing care will maintain a bed rest with a patch on the affected eye. The patient will be on bed rest. Will also instruct their client to avoid coughing, sneezing, or straining, right? And the surgery intervention, that is the sclera bulking or whichever it is, they'll have a surgery intervention for this patient. So post-operative nursing will involve, of course, bed rest, right, in the prescribed position with, of course, an eye patch and a shield in place. We always avoid jerking, bumping the head, or straining and coughing. And we administer medications as prescribed, the antibiotics, anti-inflammatory, antiemetics, okay? And we teach the patient how to self-administer eye drops on schedule. Cataracts. Cataracts is another optical issue that we should know, and it's actually slow and progressive clouding of the lens, right? And some signs and symptoms of this will be painless, diplopia, or blurred vision. It's painless. Nothing, no pain sensation. They'll also have a decreased visual acuity, and they will also have, they may have precise surroundings being dimmer, so they will not be seeing very well because the lens is dimmer. Like, think about it. If you are driving and your windshield gets, cloudy and cloudier, it's gonna get to a point that you really can't see your surroundings. Okay, so preoperative care that we need to give this patient, and this is when the patient has a dilated eye. We'll administer the medications as prescribed, normally antibiotics or corticosteroids, whichever the doctor says. And preoperative nursing for a patient with cataracts, that's after you've dilated them. We'll keep the operative eye covered, of course, prevent infection, and overstimulation. We'll elevate the head of the bed between 30 to 40 degrees, and we'll not turn the client into the operative side. We don't want that pressure occurring, right? We'll instruct the client to avoid bending on the waist, lifting, sneezing, and coughing, and avoid touching the eye area. We don't want to increase that pressure to the eye, okay? We'll also prevent the vomiting and stirring, which is also pressure, and we'll report any severe pain immediately because we don't want a patient to be in stress. If they're in pain, what causes? It causes like elevated blood pressure. We don't want that. Okay, some therapeutic measures for this patient will always be the treatment, which is the surgery, and it will be removal of the lens, usually under local anesthesia with an intraocular lens implantment. So we'll remove that clouded lens and implant another lens for them. So glaucoma. Glaucoma, it's a group of ocular condition characterized by optical nerve damage, which may be caused by increased intraocular pressure, IOP. So with glaucoma, they normally say it's like a pressure cooker for the eye, okay? Some signs and symptoms. It depends on which kind of glaucoma you have. So with acute closed angle, ocular, it's an ocular emergency. It's caused by an obstruction to outflow of aqueous humors, resulting in an increased intraocular pressure. Okay, there is rapid progression of visual impairment. There will be severe pain in and around the eye, and the patient will report blurred vision with dilated pupils, and also they'll report some nausea and vomiting as well. With open angle glaucoma, there will be an indigenous onset with slow decreasing visual acuity, right? It's usually bilateral, but one eye may be more affected than the other one. They'll report halos around the lights and loss of peripheral vision, which is normally a late manifestation. They'll also have some fluctuating intraocular pressure, and they may have no symptoms of this, okay? Our interventions for this kind of patient will always administer medication consistently on time. Remember, it's a blood pressure in the eye. You don't want that blood pressure exploding, right? And we'll avoid anticholinergic medications. Remember, anticholinergic medications dry you up. You can't pee, can't shit, can't, those kind of stuff. Medications to promote pupils to contract, right? Some of the medication we'll give them will be cholinergic, miotics, androgenic ions, some beta blockers, that blood pressure, right? The pressure in the eye, carbonic inhibitors, prostaglandins, as well as alpha androgenic antagonists. Some therapy, or how we'll treat this patient, we'll do some laser, or we'll do some drainage implants or shunts for them so they can drain that fluid so they don't end up with that much pressure. And for this patient, we're always going to teach them that how to proper administer their medication. We'll also discuss the importance of avoiding activities that may increase that IOP, which is the intraocular pressure. And we'll also educate them on the importance of follow-up appointments. Because most patients, they do not do a follow-up. So when they come, it's like so bad, okay? So let's talk about our auditory assessment. With our auditory assessment, we're going to be checking our auditory. What are our auditory? Our ears, right? We're gonna we're gonna inspect the external ear. We're gonna do an otoscopic examination. We're gonna evaluate for gross auditorial acuity, right? And we're gonna do an audiometry. Some disorders for auditory include the Meninges disease. This, you will see it in the test. So the Meninges disease is an abnormal inner ear fluid balance, which may lead to disabling symptoms. So Meninges is in the middle of the ear, okay? Some signs and symptoms for this include vertigo, tinnitus, and pressure in the ear. So what are our nursing interventions? So our nursing interventions will be to provide a low sodium small meals frequently. Why are we providing a low sodium? This patient already has a fluid buildup, right? And what? Wherever sodium goes, water follows. We don't want to increase that fluid, right? Initiate and teach fall precautions, because remember, your middle ear does what? It's your balance. If you don't have an awkward mid-ear, sensation, you're gonna be off balance. We're gonna maintain a quiet environment, and for medication for this patient, we're gonna give them some antihistamine, tranquilizer, antiemetics, as well as diuretics to reduce that pressure from the fluid. Okay, we're gonna teach this patient how to encourage them on a low sodium diet. We're going to encourage this client to drink plenty of fluid, but to avoid caffeine and alcohol, right? They're diuretics and stimulants, and it normally occurs in always older patients. And we're going to also teach them to avoid monosodium gluconates, that the MSGs, as well as aspirin and aspirin containing medication, which may increase the symptoms. This wraps up our neuro disorders, and in the next video we're going to talk about the medications for our neuro system. See you in the next one. Bye. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.